afternoon, everyone, and I am Teresa Grimes, and I'm the administrator of Washington County Hospital and Nursing Home. I am serving as Image Task Force Chairman this year, and I just want to welcome you to this webinar and to thank you for taking time this afternoon to be with us. Today we wanted to share some old as well as some new resources. These tools we feel like can be used to enhance the image of our hospitals and our community, as well as hospitals all across Alabama. So the tools today that are being discussed were actually developed by Alabama Hospital Association's Image Task Force. Several of them can be customized for our local hospital use. So today I want to start off by thanking Rosemary and Pam, as well as all of those on the Image Task Force Committee for their hard work in creating tools that we feel like will be very useful to assist us. We felt like that some people may not really know that tools are available or may not really have ventured into the website and looked at all the tools. So the purpose of today's meeting is simply that. We're going to let Rosemary walk us through the website and walk us through the tools. And as she said, we want it to be very interactive because we want you to ask questions, give us feedback. So we welcome that. So you can either tell us today, you can call Rosemary and Pam or email them, but the purpose and the goal is to let you see what's available as well as to get your feedback. We hope you'll utilize the tools, and we hope that once you do, you can give us feedback on better ways that we can improve the resources, but also better ways that we as the Image Task Force make it help you and help make your jobs easier. So once again, thank you so much. We appreciate you attending today, and I'm going to turn it over to Rosemary.
Great. Thanks, Teresa. And thanks for your leadership and the others on the Image Task Force. We really look to y'all for guidance and understand what are the materials that you need to use with your own public, be it your patients, your families, your community. And so what we've tried to do is to look at our website and move things around. We know that sometimes it's hard to find things, so we've tried to kind of put everything that we've got, most of the tools, on one page so that you can find them easily. And really wanted to use this quick call today just to show you what's out there, maybe whet your appetite. And then, like she said, if y'all think of other things that you need, let us know. So the first thing I'll show you, if you've never logged into our website, you can go right here on the top right-hand corner and click Register. And that's where you register. This is a member website, so it's for you. And you just put your name in and what organization you're with. It comes to us automatically, and then we make sure that you're a member, we approve you, and you get your login. So that's easy enough, but I did want to make sure that you've got it. And what we've done is we put everything on the website. We used to have one that was public only and then private for our members. Now we put it all together, so as you click through, you don't have to remember which side things are on. You'll see a little lock when you get the things, and that means you have to log in to get it. But once you log in, like in most websites, once you log in, you're in. So let's go through and let me show you a few things just on the front page of the site. The What's New section is always where we're going to put new things like our awards nominations. If you haven't nominated anybody yet, there's still time. So that is for some things on here are CEO level access. So if you come up on something that's CEO level, just check with your CEO and make sure they download it and get it to you. And then if you scroll down, the Friday letter is our weekly newsletter. You can get it by email, or you can come on here. A lot of times if you think, oh, I saw that in the Friday letter, but you don't remember exactly when, you can go back here and click on the Friday letter, and you can find, you can search for it. I'm not going to go in there right this second, but just know that that's where you go and you can search my name. Too far out. So you can also, one of the things I wanted to point out, a lot of people don't realize we have on here is a hospital directory. Sorry, I'm on a laptop that's not too cooperative. Okay, here we go. A hospital directory is on the, anybody can get to it. We encourage media and others to go, and it's just, you can get information on all the hospitals in the state, not just members, but like I'll click on Athens Limestone and show you what you can get. You can see the county, the licensed beds, their website, the media contact, and the services they offer. And this is something I wanted to remind the PR folks on the phone is once a year, we ask y'all to go in and you have the ability, once you're logged in, to edit your services and your information. So we really encourage y'all to keep that up to date. And you can search for things by, if you're looking at the hospital directory, you can search by type of service. So like if I wanted to see all the hospitals that have a fitness center, then I could search and see the names of all the hospitals that have fitness centers. You can search by county, or you could search by keyword. So that's it, except here is our hospice information. On the front page, our sponsors. And then to the right are just some quick links that y'all probably, if you're ever thinking about, oh, what can I do this month? We have the Health Observance Days. This is just a calendar of days for each month of what's going on, and that's what we use to send y'all our social media posts. One minute, let me get back. This is the full detail I wanted to show y'all. That if you ever want to order, the Society for Healthcare Strategy and Market Development has a booklet that has a lot more information about these dates in it, so you can order it there, but you can just go on here and click to get to them. Here's the dates. I clicked too far. And so you could forward this to whoever you need, but we organize it by month, and then you've got the days and the week. Another thing we get a lot of questions about, go back to the front page for this. Under the quick link, we have media resources. That's to get in and if media come and to know who to call at the association. We have Help Careers. We get questions on that. I wanted to show you that. It's a really cool website. If you've got a health fair coming up or anything that you're doing with students, you can go to this alabamahealthcareers.com, and you can go to Explore Careers, and you can look at all the different types of careers, like diagnostic technology, and it gives you the different types of jobs, and it gives you a job description, a salary range, education. So this is great to use with schools if you've got a project going on with schools. I want to be sure and show you that. So now let me show you the resources that we've got that we've tried to put in one spot for y'all to find. So you'll go to the resources page and communication tools. And some of these are locked, so you'll have to log in. But this sheet is one that, with the help of the Image Task Force, we developed because we really didn't have anything that kind of had everything in one spot. So let me go ahead and log in. Okay, so now we're back. So I encourage all of you today, if you don't have a login, number one, get a login, and then log on and get this first, because this shows you all the different things that you can do all in one fell swoop. So you can get the news recap, a daily, most of you probably get them, but each day we comb the newspapers, the other media outlets, television, Alabama publications, and try and pull out the things that we think you might want to know. And so we send those out daily. If you want to get them, all you have to do is let us know, and we'll be glad to send them to you. The Friday letter, same thing. It's the weekly summary of sort of what's been going on in the healthcare industry. And we do links. We do short paragraphs and links to the stories. And as a member, you're welcome to get that. We keep a list of public relations contacts. We try and keep one contact per hospital that we know is going to be that hospital's contact, mainly for media and for other public relations things. But we also have a list that we send alerts and other things to. It's an email list. So if you are doing anything with public relations in your hospital and want to be on that list, that we'll be glad to add you. That's not one per hospital. So let us know about that. We do have a number of social media things. We have a Facebook page, and y'all are hopefully familiar with that we post a number of things. And we encourage y'all to let us know about what's going on with you. We try and find things in the papers or wherever you've got them and post them and share them. But, tag posts, there's our the AL hospital handle, so if you'll use that. We have a Twitter account. And then we really have, and we're going to show you something in a minute that we've produced for y'all to use in trying to increase the number of people who know about our Facebook page. We realize we really didn't have that many followers, and all of you have tons of followers, and that perhaps if y'all could, if we sent you some stuff that was pretty easy to use, that you could refer folks to our site. And then on the website, I've listed here some of the things we went through, the hospital directory. I'm going to show you in a minute where we keep our media messages, sample messages you can use, our economic impact tool, healthcare observance dates, we talked about that. And then one of the things I just wanted to encourage y'all to do is some hospitals have us on their mailing list and others don't. But if you will, for your news releases, just put TRDEPT@AlaHA.org. That's our generic PR department mailbox. Put it on your list and send us your information, because we'd love to get it. And that's what we use to put things in the Friday letter. And in around the state in the Friday letter, I will tell you that we really try and keep that to big news. It's not news like we had a blood drive or whatever, but it's, we added an addition, or we have a new CEO, or something fairly major. But then we have the daily news recaps. I do want to mention that we try and get, for those news recaps that we pull out of the papers each day, we really try and get all hospitals information from all of you. But some newspapers, as you know, put certain things online and not others. And then some of them require subscription. We bought subscriptions to a good number of papers, but really can't afford to buy them for all of them. So if you have an article that is important that you want to send to us that ran in your paper that we didn't pick up, particularly this is more for the smaller papers that are not online, send it to us. If it's a couple of days, 1 or 2 days old, we'd love to use it, and we'll put that in news recaps. We can just make a link to it. And as always, I want to encourage y'all to feel free to refer media calls to us. I know you get a lot of calls, and sometimes there are things that you may not want to deal with on a local level, but we'll be glad to kind of give the state perspective. So, preferably you give me a heads up, which most of you do, that I'm going to send somebody to you. And the same with us. If we get calls on questions asking about a specific hospital, we will always call you too and let you know that, somebody's out there. So any questions on this before I move on? Because that was a lot of stuff all at once. Okay, I'll close out of this. So this is the thing I was mentioning on social media. This is what I developed to hopefully give you just a quick thing that you could send out. This is something that we did, just suggestion. The committee came up, they said, well, why don't we do the first part, sharing some types of things that hospitals could do, which a lot of you do anyway, but these were just some reminders of here's how you can use social media. And then at the bottom, to encourage people to follow, like, comment, share your posts, and share AlaHA's posts. But this is just kind of a how-to page on social media. We developed a fact sheet, again, with the help of the Image Task Force, that we think will be helpful if y'all have a civic organization you're making a presentation to. This is just a little sheet that we've got the most current facts that we've got from a state perspective. And one of the things that we did, now this is the PDF, but we need to we'll put or is this the publisher? This is the PDF version. We'll put a publisher version out here because we really want y'all to take this and localize it if you want to. So switch out the pictures, switch out the statistics, make it your own, but you've got a format, please. So feel free to plagiarize the heck out of this, whatever y'all need to do to it, and we will put the publisher version out there. And if you have any trouble downloading it, making things fit, we'll be glad to help you with that too, so just let us know. One of the things, and I don't have time to go through a lot of this, but something that I think people have missed, that we had a task force 2 or 3 years ago that put together a billing toolkit. And I just continue to think that price transparency is going to be something that it's just going to continue to grow. I don't see any way getting around it. And unfortunately, there's some questions that aren't easy to answer. But this toolkit has a lot of good things in it. There's a self-assessment, a checklist for looking at your own things in your hospital that you can do. There's some answers to tough questions regarding hospital billing. So if you get a reporter call, you may want to download these questions and just tuck them nearby. I mean, I kind of keep them pretty handy. We also have a PowerPoint that you could use with your own staff, because we know they get questions constantly from people, from patients and families about their bills. And there's just some things in there that I think are really helpful to go through with your staff. So take a minute to look at that. We did some sample scripts for frontline staff, billing staff, things that they can say. And we've also got messages on here for hospital websites, and then a flyer just with some general things. I'll show you this because I think this may be helpful in talking to consumers, and maybe similar wording to what we've got on the website messages, but it shows, you know, and you can, again, this is for you to personalize. It talks a little bit about costs, that they're billed separately, professional services out of network, getting the best estimate. Again, we try and point people back to their insurance companies on estimates, because that's really where they're going to find out how much they have to pay. So I wanted to show y'all that because I think a lot of people hadn't gone in and looked at this billing toolkit, and there really are some great things out there. Talked about the observance date. This is something I get a lot of questions about. We try and keep it as current as possible. It's just a sheet that you use to calculate the impact of your hospital, the economic impact. It's not showing up right this second, so we'll double check that link, but y'all have probably seen it. It just shows you can do these multipliers against your revenue, and then you do another multiplier times your employees, and also times your payroll and benefits, and it shows the impact on your community. They are statewide multipliers, so I'll caution you whenever you use it to calculate the impact, you need to really emphasize that this is an estimate. But you can also buy county level indicators if you want to really get specific. It's about $200 each, so that's why we didn't buy all 67 counties, but y'all can do it if you really have something you're working on. You can do that, and I can show you where to find it. Release of patient information is something I know a lot of times we get calls about, and this is just guidance that's been put together by a group of Alabama PR folks in conjunction with some things that the American Hospital Association put out. But it talks about what to release, what should you release, inquiries from clergy, really good stuff there on release of patient information. And then the talking point, I really want to grow this because I know y'all get hit with all kinds of things. You know, we've got flu outbreak. We tried to alphabetize these and put them in categories. You've got sort of your clinical care topics, CAC, hospital acquired conditions, infections, nurse staffing, opioid. And then hospital charges and billing. We've got something on executive compensation, hospital billing, and then security, cybersecurity, and social media. And we're going to continually add to these talking points. So don't ever hesitate to call us and say, do you have talking points on this? Because you may not remember where these are. But if you can, it's a great way if it's the middle of the night and you get a phone call and you can't catch a bus to know where you can go to get it. And then the last section is videos and presentations. This is where we've got a PowerPoint that we did several years ago that you can download and use. We've updated it with current statistics, and it goes into just sort of the history of healthcare, the good things we've done in terms of quality of care, quality improvement, and then it talks about the challenges patients facing hospitals. So really go there, look at that. Here's some videos that have been on the website for a while. They're very good to kind of explain about, this one's about the wage index. If you've got a civic group coming up, that might be a great way to introduce it. This one's about Medicaid expansion. I know we're not exactly there right now in terms of the politics of it, but it's still a good thing. And if anybody asks about it, that's a great video on that. I think that's the end. I'm going to go down to the bottom, make sure it is. I think that's about all that I wanted to talk about. I've flown through it, but we promised y'all a quick webinar. So what questions do you have, or are there other things that y'all would like to see that maybe we could help you with? One other thing I failed to mention is we do send out sample Facebook posts every month, and so we'll continue to do that and put those out here as well. We'll put those under the communication tool so that they're easy to find if you misplace it. I did want to mention before we end the call that we are celebrating Doctor's Day on a statewide level this year. We went together with Medical Association, Department of Public Health, and are going to be sending out a news release. We'll send y'all a copy of it, a statewide release with the Medical Association on that. And then are working on something for Hospital Week and really want y'all to help us with that, with stories. I was grateful for the patient safety stories we got during Patient Safety Week last week. It's just y'all have such good things to share, and I think it's not so much better if we can share local stories. So we're going to put together something for Hospital Week, and we'll be calling on you. So if you'll just be on the lookout for that, that would be great. But that's all I've got. Teresa, anything else, or Pam?
This is Teresa. I don't have anything else, but I do hope that, once again, you'll take the opportunity and go through these and familiarize yourself with them if you're not, and utilize those. Tweak those to your own hospital, and as you see that, if you see things we can do to improve, please give us a feedback. Again, pick up the phone and call Rosemary or Pam, email those. Just let us know, because our goal as Image Task Force is to give you the tools and equipment to better help you. So that's our goal. So please give us that feedback, and we appreciate it. And once again, we appreciate your time today. We know your time is valuable, and we appreciate you taking the time.
All right. Well, thank you, Teresa, and thanks, everybody. Have a great rest of the afternoon.
Thank you all.
Bye.